I'm Lainey Robinson. I am a physician here with Horizon Health in the Family Practice Department. It's important for children to get vaccinated for many reasons, but the main reason is because if we can get them vaccinated early, the goal is to provide them with immunity before they're exposed to these infections that can cause, illness and sometimes even death. If your child is due for vaccines, then it's best to get them right when they're due. Sometimes things happen and a child can fall behind, and that's okay. We can always catch them up, but the sooner the better, because the goal is to get them vaccinated, to get them protection before they're exposed, at school or at preschool or, even out in the community. And most of these schools will require these vaccines before they even allow the child to enroll anyway. So it's best to get them when they're due or catch up as soon as possible. The schedule is set by the CDC, so the Centers for Disease Control and Prevention. It's created by the ACIP, and so that's the advisory committee for immunization practices. So they kind of set the schedule based on expert opinion, and it's reviewed up to 3 times a year to make sure that the schedule is accurate. And then that goes on to the CDC for approval. And then that is typically adopted by several other organizations, including the American Academy of Family Physicians and the American Academy of Pediatrics. So there are a lot of eyes on the schedule. A lot of, scientists and doctors review the schedule to make sure, that we're following the best practices. It's always best to kind of know when the vaccines are coming. That way parents can prepare themselves, and if the child is a little bit older, you can always kind of prepare them as well. For younger children, I think it's best, bring a pacifier or a stuffed animal or a blanket that, can be kind of comforting for them. And another thing too that can really help is if they're bottle fed, bringing like a bottle, or if you're breastfeeding, be prepared to kind of breastfeed. That can really be soothing after the vaccines if the child is upset. And actually doing a feeding during or even after vaccines can help reduce some of that discomfort. So that would be a great way to prepare. So the best thing to do if you're leery about whether or not to get your child vaccinated would be to just talk with your child's doctor. Tell them what your concerns are. They should be able to answer any questions you may have. And that way too, they can provide you with the most accurate information about vaccines, the safety of vaccines, and that will help you make an informed decision on whether or not to get your child vaccinated.